Presentation will be given by Ken Awuondo. He's the Senior Biomedical Scientist working with the Global Health Network as Africa Regional Manager. He obtained his master's degree from the University of Greenwich in London, and he's been working for over 30 years in various medical research organizations in Africa. Ken has supported various laboratory research projects, as well as participated in development of clinical trial sites in Africa. He's lead mentor in the CDC MSH MOH project, strengthening laboratory lab management towards a accreditation program in Mombasa, Kenya. So without further ado, I will pass it on to Ken Awuondo for his presentation. Ken, over to you.
All right, so good morning, participants. Good morning, fellow facilitators and everybody else, wherever you are around the globe. It's my pleasure to present to you and discuss with you today on the topic of introduction to laboratory quality management systems, or in short, we call it lab QMS. To start with, I will start with the case scenario, which we shall be able to discuss at the end of, we shall discuss together at the end of this presentation. And here's the case scenario. You are the clinical laboratory manager in the medical research center. The chemistry instrument needed replacement of laser stroke filter. The engineer was informed, upon which he flew and replaced the part and flew back.
You're using a mobile phone. So
since he did not wish to miss his flight, he said he will send the worksheet when he will reach his office. The laboratory staff on the late shift reported to work after the engineer had left and immediately
Ken, sorry, if you can just pause for a second. Please, everyone mute your microphones. Thank you, Ken. You can go ahead.
Yes, so I'll proceed. So since the engineer did not wish to miss his flight, he said he will send the worksheet to his office. The lab staff on the late shift reported to work the engineer had left and did samples he found stored in the refrigerator, which was in between 2 to 8 degrees centigrade. The analyzed the samples, reported analyzed the samples, reported and released results to the clinician on call. The clinician on call noticed an elevated ALT, AST, and gamma GT on 3 different results. The clinician called the lab to confirm the 3 results, since they were not correlating with the patient conditions. So we need to discuss this at the end of my presentation, and what factors could have led to this scenario, how will you investigate occurrence, and many others we are going to discuss after the presentation. So let me proceed to the role. Before I proceed to the role, I would say that what are our learning objectives? At the end of this presentation, you will be able to understand the laboratory quality concepts and principles. You will also be able to understand how the laboratory processes are interrelated and interact with each other. And you'll also be able to identify what you need from your laboratory. But first, let's look at the role of clinical laboratories. And in this case, I'm talking about whether you're working in the research laboratory, clinical trials laboratory, or clinical laboratories. 1, as laboratorians, we provide services by transforming human organic materials into information. And this information produced can be used for making a very critical decision. It can change the way the physician thinks and acts. Secondly, the laboratory support is meant to determine eligibility of the study participants who could be included in the study or should be excluded in the study. And third, we use laboratory to monitor the safety of the intervention. if there is an investigative product that's being given to participants, how safe is it? What changes does it make in the body? And finally, the laboratory is used to primary study endpoint. We need to know the efficacy of the investigative product. And there are so many other roles of the laboratories, but in clinical trials, these are some of the ones that I'll be able to identify. Okay, let's go to the concept of laboratory quality system. And this is very important to understand. So because it's going to be what we're going to discuss in the next 2 days, over the next 2 days, this is what we're going to discuss. So we need to understand the concept of laboratory quality system. So as I've already said, laboratories support the clinical diagnosis of diseases and monitor the treatment. This is done by transforming human organic materials into information that can be used to make critical decisions. Like in this case, you can see the body organs here. We have the liver, the kidney, the spleen, the heart. So the process of transforming organic materials into information is complex. It's a complex system, that requires the sample to be obtained, collected, processed, and analyzed. The procedures and processes are required for the guidance in processing and collecting the samples and analyzing the samples. These processes and procedures need people. They need people to do them, and they should be done properly to get accurate and reliable results. The key word here is accurate and reliable. For this to be done properly, so that we get accurate, reliable, reproducible, repeatable results, we need to do what is called quality assurance. We need quality assurance in place. Quality assurance are the measures that are put in place to check that the laboratory procedures, processes, and the systems are running smoothly, safely, and effectively. The aim of the quality assurance is to eliminate the risk of non-conforming. So that's one aspect of the quality system. There's another aspect of quality system whereby it requires the machine, or sometimes call them analyzers or the instruments. The samples from the body organic materials are analyzed using this instrument or the machines. So the machine is expected to produce accurate, precise, reproducible, repeatable, reliable information. For the instrument to produce accurate and reliable results, patient results, it must be validated. It must be validated, and the process of validation is what we refer to as the quality control. The machine that's producing these results need to be validated, and the process is called quality control. So quality control are the statistical activities used to monitor and evaluate the analytical phase of the testing the samples. So the aim of the QC is to detect, identify, evaluate, and correct errors that could occur due to test system failure or operator performance or environmental conditions before these results are reported and released. So if we combine quality assurance, and quality control in the laboratory, we get what is called laboratory quality management systems, QMS. That is what we shall be discussing in the course, in this course over the next 2 days. And I hope everyone will be able to get opportunity to participate. So what are the relationship between QC, QA, and QMS? From the illustration here, you can see QC is a subset. QC is a subset of QA, and it measures the method of the procedure performance. And then QA is a subset of QMS, and QA measures process performance. So the difference here is one is measuring procedure, the other one is measuring the process. And process are the activities which are related one to another. And then there's QMS, that is monitors the entire system, It monitors the QC, it monitors the QA, and any other thing right from outside the laboratory to inside the laboratory. So if you have your laboratory and you don't have QMS, then there'll be a lot of mistakes. If you have QMS or if you have quality management systems, then it can be able to detect problems before it occurs. So what are the, we want to compare and contrast the QA here and the QC so that we can be able to understand clearly what they all mean. QA is a process. It's a series of actions or activities. QC is output, is the result produced by the analyzer. Secondly, QA is a proactive approach which eliminates errors before they occur, have a chance to appear. And QC is a reactive approach. It responds to events after they have occurred, after they have already happened. Thirdly, QA monitors accuracy, reliability, and timeliness of total testing process. QC monitors activities related to the analytical phase of the testing. Fifth, QA prevent mistakes. QC detect mistakes. Finally, QA is a whole team effort, right from sample collection to the time that the sample is released. It's a process, it's the whole team. But QC is specific team. If you are in a biochemistry department or if you are in a hematology department, it's just that team in that section that is dealing with the QC. So those are the differences between QA and QC. So what are the phases of quality management system? If you are doing your quality management system, there are three main phases. One of them is pre-analytical phase. Here involves the laboratory request forms, sample collection and transport and storage, sample labeling and identification, staff training. And here, this is the phase with a lot of errors. In fact, about 60 to 70% of errors in the laboratory occur in this phase. And it could be errors ranging from misidentification to not labeling to inappropriate specimen collection and many, many others, etc. And then there is analytical phase. Here in this phase, it involves sample reception, equipment validation, method validation, internal quality control system, reagents and kits validation, etc., etc. There are about 15% of errors occur here, some ranging from undetected QC failure to use of expired reagent. And there are few errors here because there are a lot of training has taken place in this phase, and therefore you expect less errors. And finally, there is post-analytical phase. This involves review and release of results, or communication between the laboratory and the ward or wherever the sample is being sent to. There are about 23% of errors occur in this phase. And it involves, ranges from transcription errors to critical value not reported. So those are the three main phases of the QMS quality management system. And over the next few hours or days, we'll be talking about procedures or processes in these phases. So if you have a poor quality management system, it leads to a lot of laboratory errors. And the impact of laboratory errors ranges from failure to provide proper or right treatment to the patients. Secondly, there's additional or unnecessary diagnostic testing. There's unnecessary treatment and treatment complications. And if you go to a non-quality management system laboratory or non-GCP laboratory, what you're likely to see is just the tip of the iceberg. If you go to any laboratory, the first thing that you see are the staff. And when you see the staff, you may be able to see staff who are having low staff morale. That's what you can see. And you can also say, probably you are also going to meet a customer of this laboratory, or even probably before you go to this laboratory, you have already met a customer of this laboratory, and the customer is complaining. So those are just the tip of the iceberg. But if you go further into the laboratory, and probably if you are doing audit, some of the things that you are likely to see here will involve, for example, results and reports. You are likely to see false positive, a lot of positive results if laboratory is not quality management system or non-GCP compliant. You are likely to see negative, false negatives. You are likely to see a lot of transcription errors, or sometimes the results sent to a wrong location. And you can also go to, if you check the testing, you'll find there's a lot of shortcuts in doing the testing. QC failures are ignored. QC has been done, it has failed, but nobody is taking any action. This happens a lot in non-quality management system laboratory. If you look at the samples, a lot of sample rejection, or sometimes they're not being rejected, and yet they are supposed to be rejected. There's a lot of samples that getting low. There's a lot of mislabeling, or sometimes the samples are not labeled. And if you look at the equipment, you see the downtime. The equipment has been there for 6 months without any PMI, that is preventive maintenance and inspection. You find a lot of out of stock for reagents, and sometimes equipments are not calibrated. So these are the things that happens in non-GCP and compliant laboratory. So what's the difference between non-accredited and accredited laboratory? One, in non-accredited laboratory, they are oblivious of the problem. They actually don't know that the problem exists. They are, they obfuscate problem. They ignore the failures. If QC has failed, they just simply don't care. They do not investigate. If there is any problem, no investigation taking place. And no action is being taken. But if you go to a laboratory that is accredited or GCP compliant, you're likely to see that the problems are less, because they detect the problems before they occur, they investigate them, they take action, and the errors are likely to be less than 1% of the errors, because they had been detected and investigated and action taken. So if you are to build, if you're going to build your QMS system, what are the building blocks? This involves one, organization, the personnel, you look at the equipment, you look at the facilities and safety, you look at documents and records, you'll be able to look at process control, you need to look at the information management, you need to build your occurrence management, you need to look at your assessment, that is audits, you need to build your process for improvement, you need to customer service, and you also need purchasing and inventory. What are the key steps? What are the key steps to quality management system implementation? That's step number one. You probably, if your laboratory is already having QMS, probably you already passed through this stage. And if you have not, if you're planning to develop your quality management system, then these are some of the steps. Not all of them, but these are some of the steps that you are likely to go through. Step number one. Step number one is a very difficult phase, and it takes a lot of period. It takes like 1 to 2 years. It is the commitment from the top management, and sometimes this management does not understand what quality management is all about. They may not be committed to it, and it needs a lot of persuasion. You need to talk to, you need to motivate staff and support staff. You need, management also needs to allocate resources for this process. You need a quality policy. You need to look for, select the standards that you're going to follow in developing your quality management system. Step number two probably might take you 6 to 8 months. It's involve staff, lab staff. The staff should own the process. If you're going to do it alone as a laboratory manager without involving the staff, you'll be wasting a lot of time. The staff should own the process, and you need a buy-in. Not everyone will come along with you but at least if you get 3/4 of the staff coming along, the rest will follow later. Step number 3 is you need to do gap analysis with selected standards. And how do you do gap analysis? You look at the standard, you look at what is the status of the laboratory at that time, and then you define the target where you want to get to, and then you develop a plan, and you delegate responsibilities to your staff. Step number 4 is implement the QMS plan. This will be easy if step number 1, 2, and 3 has been undertaken, and it can equally take you less than 6 months. You need to implement the QMS plan. You start with the technical areas, the IQC, the EQAS. You look at the documentation, which we will discuss immediately after this, after my presentation. We're going to discuss about documentation. And step number 5 is the lab audit. You need to train your internal auditors. You need to reevaluate the gap between standards and current status. You need to implement corrective action, preventive action, because there'll be a lot of errors occurring in the system. And if you don't have your CAPA, your system will be as good as dead. Now let's talk briefly about the origin of GCLP. Because this involves, apart from quality management system, you also need to discuss GCLP briefly. If we step back a bit to the year 2002, WHO published a handbook for the good clinical research practice. And in this book, they said that for specific health medical products and treatment practices to be implemented or put into use, they must be safe and effective. Safe and effective is the key word. So for that to happen, we must conduct clinical research, clinical trials. Clinical trials must be conducted to gather data enough to prove that the product is safe and effective. And clinical trials is designed to answer important scientific and healthcare questions. GCP, and for clinical trials to be conducted, it must be done under the principles of GCP. And the GCP principle states that it's a standard for designing, conducting, recording, and reporting clinical trials. It mainly looked at the safety, the rights, and the well-being of the participants. And so we had the GCP, no specifics for laboratories. The GCP is there, the good clinical practices, but they are not specific for the laboratories. The closest they have come to the laboratory is to ask for lab reference values. Anytime you see somebody coming for GCP in your laboratory, the only thing they ask you, laboratory reference values. They also ask you for laboratory accreditation, and they also ask you if you've got quality control system. We have the GCP, but it's not for laboratory. And then we have good laboratory principles. Good laboratory principles was established in the 1990s by the Organization of Economic Cooperation and Development. And the principle states that they ensure consistency, reliability, and reproducibility, quality, and integrity of the non-clinical studies. The key word here is non-clinical studies. So they do not apply to clinical studies. So GLP is not specific for lab supporting clinical studies. GCP is clinical studies, but it's not specific for the laboratory. So there was a dilemma here. We have guidelines that are for clinical studies, but not specific for laboratories. And we have guidelines which are laboratories, but they're not specific for the laboratories. So somebody thought about it and said, the best thing that we could do so that we can have principles for good clinical laboratories is to have hybrid of GCP and GLP. And that's how GCLP came about. And GCLP principles ensures that accurate, reliable, and credible data is generated from the laboratory. GCLP applies to standards established under GLP, relevant to analysis of samples from clinical trials, while at the same time ensuring that the principles of GCP are satisfied. So that's how the GCLP came about. Now, which way to go? Probably in your laboratory, if you are considering whether to go for GCLP or you want to go for ISO 15189 or Afro WHO SLIPTA, this is the best time. You are in the right course. This is the course for you. You'll be able to make that decision. Or probably if you have enough resources, you can go for both GCLP and ISO. And GCLP guidelines will help the laboratory decide its own standards. It's less costly. Whereas 15189, that follow the standards that were prescribed by the third party. It's a little bit costly, but if you have resources, you can go for both. Now, what does GCLP and ISO 15189 have in common? They have a lot that they share, but they also have a lot that that differentiate them. If you look at what they share, the document control, which we are going to talk about here at length, the quality management they share, all of them need quality management, corrective actions, records control, reporting of results, laboratory information system, and there could be other things that they share, probably not listed here, but probably we shall discuss together, like, the audits are also shared, GCLP and ISO 15189. Now, what's the difference standard, same goal? Whichever standard that you are going to follow, whether it's GCLP, guidelines, or Afro WHO SLIPTA, or ISO 15189, or CAP, that's College of American Pathology, they may be different standards, but the goal is the same. And the goal is, which is what we want to identify in our laboratory, the goal is, and the potential benefits of this are, lab systems must be efficient, reliable, and reliable. Secondly, lab processes and lab procedures. Lab processes must be standardized and consistent. Lab procedures must be reproducible and repeatable. Lab results must be accurate and precise. Lab reporting must be timely and prompt. And this is ideally what we want from all our laboratories. And these are the potential benefits of quality management system and the GCLP. Now, and that's the end of my presentation. And what I would like to do right now, with the guidance of the team, the facilitator, other facilitators, we want to discuss briefly this scenario that I presented, and I welcome all of you to contribute. We'll be guided by the chair for this is Dr. John Tembo. Will be able to chair this discussion. And what I had said is this scenario is you are the clinical laboratory manager in the medical research center. The chemistry instrument needed replacement of laser or filter. The engineer was informed to which he flew and replaced the part, and then he flew back. Since he did not wish to miss his flight, he said he will send the worksheet to his office. The lab staff on the late shift reported to work after the engineer had left and immediately processed 13 samples we found stored in the refrigerator between 2 and 8 degrees centigrade. The lab tech analyzed the samples, reported and released the results to the clinician on call. The clinician on call noticed an elevated ALT, AST, and gamma GT on 3 different results. The clinician called the lab to confirm the 3 results since results were not correlating with the patient condition. The question is, what factors would have contributed to this scenario? Anybody with a suggestion?
Hello, everyone. At this point, we'll ask you to type your responses into the chat, and we'll be able to read the responses from, we'll be able to read selected responses from people.
Okay. John, can you read any data determined?
So to answer the question, what factors could have contributed to this scenario? We have a response from Albert Chama, who says the lab personnel did not run calibration and QCs.
Yes. Go ahead. That's good. Yes. Another one. That's one lab personnel did not run calibration. That's correct. Any other answer? Okay, let's proceed to the second question. Let's proceed to the second question. How will you investigate this occurrence? How will you investigate this occurrence? Anybody, any answer?
Hi, Kennedy. Franklin speaking. Sorry to interrupt. There are a couple of answers to your first question.
Yeah.
If I can just quickly go through them. Some so lack of organization.
Oh yes, lack of organization.
Lack of communication. So the lab staff clearly did not know that the machine was serviced and did not run the QCs. That's from Samuel.
Very correct.
There's the instrument lab validation.
Yes.
So the instrument was not validated.
Yes, correct. I agree.
And Said says the engineer at least should have communicated on the performance of the instrument.
Yes, that must happen. That should be, whenever the engineer comes to your site, they must complete the worksheet and leave, not just leaving the laboratory, walk in and walk out. They must communicate with somebody who's in the laboratory there. Any other answer? Good answers coming in. Answers coming in.
Willie Brand says the lab
most personnel. Of the answers.
Oh, sorry.
No, it's okay, Franklin. I was just going to say most of the answers are talking about lack of calibration of the machine and lack of communication between the laboratory and the engineer. Yeah. So that's for question one. I'm guessing we can move on to question two. How would we then investigate this occurrence? So if everyone can type in their responses to question two, how would you investigate this occurrence?
If there's any answer that has come in, please just read for us. Any?
Yes, so Zamkule Matsebola says, I would use the 5 whys. I'm not sure what that relates to. Ken, I'm sure you're the expert on that. You interpret that.
I think the 5 whys is like how, why did it happen? What happened? How did it happen? What happened? And yes, I think one of them is why, how, when, who. So those are, I think, the 5 whys, which is correct. I agree.
Okay. So Albert Chama says, to investigate, you first check the calibration and the QC data sheets. That's from Albert Chama.
I agree.
To investigate you
first. And then QC. Yes.
Wangwe Nicholas says, worksheet must be produced.
Worksheet must be produced. I agree. Very correct. From the engineer, worksheet comes from the engineer.
Yeah, go ahead, Franklin. Is that
so
you?
I like this one from Steven. He says you have to complete a non-conformity form as a guide in the investigation. For example, the
Yes.
problem reporting personnel classification, and then you do a root cause analysis and take corrective actions and preventive actions.
Yes, the key word there is root cause analysis. The key word is root cause analysis. I agree. And then you complete the backup form. I agree. Root cause analysis must be done. Any other before we move to 3?
There's one from Kayode Adiemi. Investigation of the occurrence could be by checking lab records of the technician that reported the results to the clinicians. See if there are variations in testing criteria from the normal standards set by the manufacturers. So that's from Kayode Adiemi.
Okay. Lab record of the technician was performed the test. Yes, these are all good inputs coming in. And since many people have got systems in place, let's move to question number 3. If there is any number 2, we'll still go back and read. If there are any answers to question number 2, we'll go back and read them. Number 3, should the doctor trust the other 10 results? There were 13, 3 of them had elevated results, and the 10 are fine. Should the doctor trust the other 10 results? Just yes or no. Is there anybody with yes?
We're getting an avalanche of no's here. There's no yes in the group.
Is there yes? If there is yes, I would like to know why. If there is one yes. Okay, the answer is, as you can see, is consensus no. Number 4. Which phase of quality?
Sorry, Kenneth, do we have a yes answer?
Okay, yes answer. How many?
One side said yes if the IQC results are within the indicated ranges.
Oh, that's a good answer, by the way. If the QCs were run and they're within, then the doctor should trust this result. I agree. That's a good answer. If it's yes, the answer is no. But if the person has given yes and qualified it and said that if the IQCs were within the range, then you should go ahead and release the results. I agree. That's true. Number four. Which phase of quality system did this error occur? We talked about 3 phases. So which phase of quality system did this error occur?
We're getting answers that say the analytical phase. So that seems to be the predominant response, is the analytical phase.
Okay. Analytical phase. Yeah. We'll see. Okay. Analytical phase.
So
there are a few that say pre-analytical as well.
Okay. Pre-analytical and analytical phase. So those are 2 phases that are already there. That's coming from the participants.
Yes, that's what's coming from the participants.
Okay. Now, the final one. Number 5.
Could everyone please mute their microphones? Please mute your microphones, everyone, so that we can proceed.
As the laboratory manager, that's number 5. What measures, and this is very important for everybody, I would like everybody to give input here. As the laboratory manager, what measures will you put in place to prevent recurring? Expect answers from everybody.
We've got SOPs and then train all staff on the new SOPs.
Good.
Again, retraining from Remy G. Pascal.
SOPs, retraining, refresher course.
Yes. It need to enhance communication.
Enhance communication, correct.
Review competency records for technicians. I just got that one in as well. We got retraining and more communication.
Already said.
Root cause analysis and take corrective actions.
Root cause analysis and corrective action. Put CAPA in place. Corrective action in place. SOP.
Provide proofs of or documentation of services performed, proper training of staff on SOPs, ensure flow of accurate information between staff.
And that is documentation. Documentation, very important. We're going to talk about, there'll be a topic on documentation coming. Next.
Okay. Place job aids to communicate issues of QC after service.
Job aids, yeah, I agree, very important.
Okay. CAPA needed and SOP to be followed by all staff.
Okay.
Yeah, so those are the majority of the responses that we're getting. Retraining, proper documentation and communication is one of the other responses.
Okay. Now let's look at them briefly, the answers. So what factors could have contributed to this scenario? Analyzer part was replaced, but calibration was not done. Personnel issues, somebody talked about that because there was lack of organization. So that involves personnel issues. The staffing or the workload of the staff or the staff handing over, incomplete equipment service, and many others that has been listed. No calibration was done, a lack of communication, no lab validation. Number two, should the doctor trust the other 10 results and why? Doctor should not make any decisions on the 13 results until root cause is investigated and resolved. Results appears inaccurate. Number three, how will you parents? Some people have already mentioned the 5 whys. Staff training, run the QC materials, check calibration, repeat the 13 samples, old sample and the fresh samples needed to be repeated. Number 5, which phase of quality system did this error occur? It's the analytical variables. There was personnel, probably lack of training, the method, SOPs probably were not there, the materials, the instrument probably was, PMI was not in place, the environment could also contribute. Number 5, as the laboratory manager, what measures will you put in place to prevent this from recurring? Use the incident as opportunity for quality improvement. Arrange the laboratory staff training. Many people have already mentioned that. Clarify the contract with the vendor and spell out the scope of work, because the vendor just came in, the engineer came in and walked out and did not leave any record. So the contract needs to be spelled out very clearly, stating that what the vendor should do and the documentation. Some people have mentioned standard operating procedures should not be in place. Equipment logbook should be there. Staff handing over, and so many other things that have already been mentioned, like enhanced communication within the laboratory. That's a part of staff handing over communication, documentation, the job aids, and etc. and etc. And this marks the end of my presentation. And I want to thank all the participants for giving the listening ears and also participating actively in our case scenario. Thank you very much, everybody, and fellow facilitators. Acknowledgement to the global health team, and this includes Professor Trubilang and all the staff operation team working in the global health network. Thank you very much.